Hello, everyone, and welcome to What Matters to Her Facebook video series once again. And as always, we are privileged to have our very own obstetrician and gynecologist, Dr. Probhodana Ranaweera, joining us today again. So, today we are going to discuss a very important topic for women of all ages. So, without further ado, let's see what question we are going to ask our doctor. Doctor, could you please explain to us the importance of women undergoing breast cancer screening, and what are some of the risk factors involved, and what are some of the abnormalities to look out for?
Now, all women, because breast cancer is very, very common in the world, and I feel like it's becoming more and more prevalent in the current, in the modern era, maybe due to the food we take, or I don't know, right? There are, whether we are getting, because of environment pollution or whatever, I don't know, or maybe genetics, I don't know. It's on the rise, right? Now let's say about 1 in 8 women will have breast cancer, or there's a risk of breast cancer throughout their life. So there are certain women who have a higher risk, especially if their mother, grandmother, aunts have either breast cancer, womb cancer, ovarian cancer, or bowel cancer in their family. So they have a increased tendency for breast cancer. If they have taken certain chemotherapy agents due to some other problems, then they have, and some of the hormones and things that we might have to give for certain reason have an increased risk. So if you are a high risk woman for that, they have to start very early. And I would say all women, they should know how to do the self breast examination during their showers, or at least every time that you go for the shower, or at least once a month, that you should do, kind of lie down and then do it in a this you have more, all these are available in the YouTube videos, so you can see one of those, then they will know how to do it, what we call self breast examination. So if you feel anything abnormal, please go and see a doctor. Then before 40 years, we tend to scan the breast by ultrasound scan, and which can detect early breast cancer lesions or things like that. But mammogram is the current thing that it has been there for a long time, which detects very early breast cancer. So after 40 years, it's better that if you do it at least once a year if possible, or at least at 40, and then maybe later life. Though there is, according to the guidelines, there is no screening program for breast cancer, because it's common, and you can't screen all women, because if it's a national policy, then every woman have, every 40 years, that means a lot of women. So which overburden the system. So we can't do that. But it's always better, at least the self examination. And if you find anything, go and see. But if you can afford and is available, get a mammogram after 40 years at least once, and maybe yearly if possible during your normal health check. There is always cancerous and non-cancerous causes. So most of the time it's going to be an uncancerous thing. But sometimes if it is blood stain, if there's changes in the nipple, the color has changed, you can feel a lump, or may not be, or even maybe not a lump, but there's a small ulcer or something, that those are bad things that you need to see a doctor immediately. Sometimes even when there's bleeding, it can be alarming, but you have to go and check it. But again, as I told you, it's going to come as benign or non-cancerous. Sometimes you will have milk kind of discharge from you, sometimes either one nipple or both nipples, and that can be what you call a symptoms of something called prolactinomas. That is a kind of a brain tumor, right? And again, nowadays we can treat it with medicine itself, right? So no operations are needed, rarely operations are needed, and sometimes you can't even see them, because they call micro tumors, very, very small ones. And but there are criteria, so always better to check if this nipple should not have discharges unless it's breastfeeding. So if there's anything, better to get it checked done, especially nowadays because of the high risk of breast cancer.